Part A. In this part of the test, you'll hear two different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with the information you hear. Now, look at the notes for Extract 1. Extract 1. Questions 1 to 12. You hear a general practitioner talking to a patient called Mihiraa. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, Mihiraa. I'm Dr. Mitchell. How may I assist you today?
Good morning, Dr. Mitchell. I've been experiencing some rather perplexing symptoms lately, and I wanted to get them checked.
Certainly, Mihiraa. Could you please tell me the nature of these symptoms?
Well, doctor, I've been grappling with an extraordinary sense of fatigue, and my musculature appears to be exhibiting a state of weakness that has persisted for a few weeks now.
I see. Could you describe these symptoms further? Are there specific regions where you feel weakness, or Mihiraa, is it a pervasive sense of fatigue?
Primarily in my lower extremities, and at times my upper limbs show a considerable degree of heftiness. But now it's affecting even my face. I've also noted a certain dysphagia.
I see. Mihiraa, can you tell me more about this weakness? Does it come and go, or is it constant?
Activity triggers intensification of the weakness, which partially subsides with rest but never fully remits.
Have you experienced any other symptoms, Mihiraa, along with the weakness?
Well, yes, actually. My vision gets blurry sometimes, and I have difficulty swallowing occasionally. Also, my hands feel clumsy, and I've noticed trouble with balance.
Interesting. Have you tried anything to alleviate these symptoms, Mihiraa?
I've been taking painkillers, but they don't really help. I tried some over-the-counter muscle relaxants too, but no improvement.
Now, Mihiraa, have you had any other health concerns in the past? Any significant illnesses or surgeries?
Not really, doctor. I'm generally healthy. I did have bronchitis a few years ago, but that cleared up completely.
And what medications are you currently taking, Mihiraa, apart from the painkillers you mentioned?
Just some blood pressure medication, lisinopril.
Okay. Do you work, Mihiraa? What kind of activities do you typically do?
I work as a construction supervisor. My role necessitates a high degree of physical activity. Recently, however, the demands of the job have become increasingly taxing.
Any known allergies, Mihiraa, to medications or foods?
No, not that I'm aware of.
I see. Mihiraa, your symptoms and their presentation raise some concerns. To get a clearer picture, I'd recommend a test called a single-fiber electromyography, or SFEMG. It's a specialized test that helps diagnose neuromuscular junction disorders.
A neuromuscular junction disorder? What does that mean?
Mihiraa, it refers to a problem with the communication between your nerves and muscles. SFEMG can specifically assess the release of a neurotransmitter called acetylcholine, which plays a crucial role in muscle movement. Imagine your nerves like wires sending signals to your muscles, and the neuromuscular junction is like the plug that connects them. Mihiraa, when there's a problem with the junction, the signals don't get through properly, leading to muscle weakness.
I see. That sounds serious.
It can be, Mihiraa, but there are different types of neuromuscular junction disorders, and some are more treatable than others. SFEMG can help us identify the specific type you might have. One possibility is Lambert-Eaton myasthenic syndrome, LEMS, an autoimmune condition where the immune system mistakenly attacks the neuromuscular junction.
What? That's quite a mouthful. Anyway, if you think it's necessary, I'm willing to do the test. I just want to get to the bottom of this and hopefully find some relief.
Absolutely, Mihiraa. I'll get the referral in order, and we'll discuss the details and next steps after the test results are available. In the meantime, continue resting and avoiding strenuous activities.
Thank you, Dr. Mitchell. I appreciate you taking the time to explain everything to me.
Extract 2. Questions 13 to 24. You hear a neurologist talking to a patient called Mihiraa. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, Mihiraa. Please, have a seat. It's good to see you again.
Good morning, Dr. Gilbert. Thank you for seeing me.
So, Mihiraa, how have you been feeling since our last appointment, 3 months ago?
Honestly, not much has changed. The fatigue is still there, especially in the afternoons. And sometimes, the tingling in my right hand gets pretty bad.
I see. Have you noticed any other changes in your symptoms? Any new problems, Mihiraa?
Well, maybe. My coordination hasn't been as good lately. I tripped while walking the dog a couple of days ago, which never used to happen.
That's concerning. Mihiraa, have you been following your treatment plan as we discussed?
Yes, I try to do the physiotherapy exercises every day. It's not always easy, but I'm doing my best.
I understand, Mihiraa. Now, let's talk about your medication adherence. Have you been taking your disease-modifying therapy as prescribed?
Yes, Dr. Gilbert. I'm very committed to my treatment plan. I know how important it is to stay consistent in managing the progression of my MS.
That's good to hear, Mihiraa. Adherence to your treatment plan is crucial in managing multiple sclerosis. Have there been any other medical issues you've encountered since our last meeting?
Not really, Dr. Gilbert. Just the usual fatigue and occasional dizziness, which I assume are related to the MS. And it's harder to stay active sometimes.
Right. Now, let's talk about lifestyle modifications. Mihiraa, have you made any changes to your diet or exercise routine?
I've been trying to eat healthier, but with work and family, it's tough. Exercise is difficult with the fatigue, but I try to go for short walks when I can.
I understand. We can look at ways to make adjustments that fit your schedule better. Mihiraa, are there any other issues you'd like to discuss today? Anything that's been bothering you?
Honestly, Dr. Gilbert, I'm worried about the future. This disease is unpredictable, and sometimes I feel like I'm losing control.
It's natural to feel that way, Mihiraa. Given the persistence of your fatigue and some lingering symptoms, I recommend further testing. How do you feel about it?
I understand your suggestion, Dr. Gilbert. If we can monitor things closely, why not?
This condition can be challenging, but Mihiraa, with proper management and support, you can lead a fulfilling life. I want to recommend a spinal MRI with gadolinium enhancement to get a more detailed picture of your central nervous system activity. To get a better understanding of your individual case and potential treatment options, Mihiraa, I'd like to recommend a lumbar puncture. It's a minimally invasive procedure that helps analyze cerebrospinal fluid. These can provide valuable insights into your MS activity.
Okay, I understand. Can we schedule those soon?
Absolutely, Mihiraa. My assistant will get you an appointment before you leave today. Remember, managing MS is a continuous process, and we'll work together to adjust your treatment plan as needed. I'm confident we can optimize your well-being and control the progression of your disease.
Thank you so much, Dr. Gilbert. I truly appreciate your support and guidance.
That is the end of Part A. Now, check your answers.
Thank you for watching. Please like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.